When a patient has a medical or traumatic emergency, there are sometimes physical obstructions in their airway that must be cleared before they receive further treatment. This can be tricky to deal with, but in the case of fluids, such as blood or vomit, suction can be a very effective tool. Turn on the suction by flipping the switch on the side of the box. To test the force of the suction, forcibly crimp the tubing in one hand and listen for the strain on the motor as it fails to pull air through the tubing. The white plastic top should also visibly suck down as a vacuum is created. To ensure that the suction catheter doesn't go too deep in the patient's throat, you should first measure it from the tip of the patient's earlobe to the corner of their mouth. Keep track of this point, either with a finger or your eyes, and do not allow it to pass beyond the patient's lips. Suction should be done in small circular strokes, starting from the back of the throat and moving forward. Do not provide suction when moving into the back of the throat. It's important to note that some rigid catheters have a hole in the top to control suction, while others don't. On a catheter with a hole, it will not provide meaningful suction until the hole is covered. If the catheter you are using has no hole in the top, the suction must be controlled by crimping the tubing, as was shown earlier, to test the motor. It is important to familiarize yourself with each type of catheter, since the control of suction time is incredibly important. Suction should be limited to 5 seconds at a time for infants, 10 for children, and 15 for adults. After suctioning a patient, they should be hyperoxygenated due to the potential loss of air from both their airway obstruction and the suctioning process.